Good afternoon, and welcome to our live kidney stream. My name is James. I'm director of the renal program here at Grand River. We're the regional program that looks after everybody with kidney disease in the Waterloo-Wellington area. March is Kidney Awareness Month, and so we thought we'd give you a quick glimpse of what it's like to live with kidney disease and specifically what dialysis means. So I've got some great guests here with us to walk you through the next half hour, answer some of your questions, and hopefully give you some insight in terms of what it's like with life on kidney disease. Hello, Melinda.
Thank you, James. Hi, my name is Melinda. I am one of the educators here at the Waterloo-Wellington Regional Renal Program, and my colleague Riza is with me.
Hi.
Welcome. Thank you for joining us. Before we get started, we just want to talk about a few disclaimers. There will be no clinical advice that's provided. However, we recommend that you speak to your caregivers if you have any questions. As we are in a hospital environment, you can see that we are wearing our masks. You might also hear some overhead pages that happen, and we'll just take a pause when that occurs. And also the last thing, as we are actively providing patient care, should we need to attend to their immediate needs, we will pause and cut the live stream, and we will be happy to share some resources for you to refer to later on. And we have our wonderful guest here.
Hi, I'm Brenden. I am an extremely long-time dialysis patient. I have kidney disease stemming from when I was about 19 years old. And it was a simple lack of antibiotics during a infection that I had, and I ended up with scarlet fever, which caused my kidneys to fail. I was very blessed to receive a kidney transplant that lasted me for 2 years before it failed again. It happens, and it's unfortunate, and of course we'd like to avoid all of those things, but it does happen. So at least if I'm going to be here, we have some amazing people who help us get through our sessions and help us live the best possible life we can while dealing with renal failure. So thanks to all of them, and thank you all for coming. We really appreciate that. I guess now would be the time I introduce my amazing nurse, Riza, who can introduce herself.
Thank you, Brenden. So if we think about what the kidneys usually do, they help regulate your blood pressure, help remove toxins from your blood. They regulate electrolyte imbalances throughout your body and help remove excess fluid. And they also help to increase your hemoglobin levels. So it's essentially what we're trying to do in dialysis is to help mimic those regular kidney functioning that a normal kidney would do.
Our regional renal program does support patients along multiple steps in their kidney journey, right from our multi-care kidney clinics where we start the journey through to our Right Start unit, outpatient hemodialysis. We also have acute hemodialysis, home hemodialysis, and peritoneal dialysis. And the last modality would be conservative renal care. So our efforts through all of those components are to help advocate for the patient, to educate them on their needs, and to work with our amazing team of nephrologists, nurses, dialysis assistants, our clerical renal tech. We have nurse practitioner, pharmacy, dietitians, social work, and a transplant coordinator, and it really takes a team to take care of these individuals.
So generally speaking, our patients would normally come 3 times a week for 4 hours. This is exactly what a patient station would look like. So we've got our dialysis machine and a dialysis chair. These chairs are really, really nice. They actually recline and go up to help with setting our patients up and putting them on the dialysis machine. A lot of these chairs are actually generously provided by the Grand River Foundation.
So you can see here that Brendan's actually on treatment right now. Before we've started treatment, there's been some assessments from the nurse, in terms of a weight. We listen to their lungs and their heart, and we also look for any signs of edema or swelling before we start treatment. And it's really important for us that it's patient focused and that we're collaborating with the patient to determine their goals for treatment today. So it does look maybe a little bit intimidating, this machine. You can see that the blood is being pulled from the body. It's being run through a blood pump. And really the magic is happening in this dialyzer here. It essentially mimics the regular function of a kidney, and it does so through osmosis and diffusion across a membrane, and that helps us to remove toxins and extra fluid. I know it might look like a lot, but really there's only about 300 mL of blood that's in the circuit at any time. So if you're thinking about even just a regular water bottle, that's 500 mL. So not even a full water bottle. A volume is physically out of the body at any given time.
So in terms of accesses that we would use for our dialysis, there's three technically, but there's two main types of accesses that could help us get access to that bloodstream. So we've got our most used one, which is our central venous catheter. You can see here there's two different lumens. We've got a red lumen and a venous lumen or a blue lumen. With Brenden, he actually is what's called an arterial venous fistula. So we would actually use needles into the patient's arm and pull blood and return blood through those needles. Brenden, I'm not sure if you want to talk
About
your access and your
Sure.
day in life.
I have a second fistula. So I did have a fistula that lasted me about 7 years, and essentially they've taken the artery and the vein and connected them to create sort of a super vein, and that allows for greater volumes to pass through the needles. Our needles are significantly larger than a regular needle, and so what we need to do is make sure that we get the needle into the correct part of your fistula and then pump it at a speed that's generous enough that we can clear the most volume of blood, so we filter the greatest volume possible during a session. So the higher of the pump speed, the more blood we get to filter. So we use a vein that's probably about an inch wide for me specifically, and we take one needle here, which is the arterial needle, and that will take the blood from your body, and then it runs through the machine, the filter, and then is returned through the venous needle, which is generally about this far apart, potentially even more. So as you can imagine, very large needles. The one question everybody asks, does it hurt? And the reality is they are big needles and they are uncomfortable, but every patient, they experience pain differently. So it can be, for some, incredibly distressing and cause pain. So there are barriers as far as finding the right dialysis method for each individual person, but we have an amazing team that talk options as far as the many, whether you have a central line catheter in your chest or an emergency line in the side of your neck. Clearly, I believe, and I think statistically, the quality of dialysis tends to be higher in hemodialysis than it is peritoneal dialysis, which is just a filtering of the lining of the stomach. So yes, that's my access. It can be weird looking. The veins, I know it's hard to see, but do bulge significantly. And that's the entire purpose, so that we're not blowing. I don't know if any of you have seen when you went to give blood or whatever the case is, getting blood work, and you will see these little tiny needles, but even that, the pressure can be enough to puncture the small vein. So in order for us to facilitate dialysis, we need to use far thicker needles to to help push the blood through the filter.
It's really important for us as a renal program to focus our decisions to be involving the patient and to really have that patient-centered care. So a lot of effort is put into education with the patients, making sure that they have informed decision making, and they're picking the dialysis modality or treatment that best suits them, and they're picking the correct access that best suits them. It really is driven by patient choice and what their unique circumstances are in terms of their lifestyle and in terms of their dialysis needs. For sure.
Brenden, why don't you tell us about or what it's like being a dialysis patient on a day-to-day basis?
As you can imagine, it's not particularly pleasant. There are many side effects that come with renal failure, including extreme swelling, which can affect your heart as fluid stays in your body. Normally, you would void your bladder and it would remove the waste, etc. But many dialysis patients actually have no urine output, which can make it complicated. You can feel heavy in your chest. You can either have extremely high blood pressures or extremely low. So it's important that when we are doing it, we are getting the best information for the machine and for our nurses to help facilitate a more successful dialysis. So things like your temperature or your weight, which is super important because as they remove fluid from your body, it can cause extreme highs and lows, but it is something that's necessary because without your bladder voiding in a normal way, they have to actually remove it during your dialysis session. So it can be incredibly uncomfortable, and there are many complications that can come from it, passing out, etc., and cramping, which seems to be one of the highest barriers as far as patients on dialysis. It can be extremely painful and instant. I don't really know if there's anything more I can think of.
I think that it just speaks to why it's so important that the nurse and the patient collaborate with one another in terms of the treatment goals. And to know that when we start treatment, we're not necessarily locked into some of those specific parameters, and that the treatment can be tweaked as we go to meet the needs of the patient. So we really rely on open communication to make sure that we are suiting the needs of the patient.
One of the many things that patients experience, and one of the complications that comes from dialysis, is having to remove certain proteins, etc., that you would gain just in your regular daily diet. So there are tons of restrictions, not just to your fluid intake, but also the things you eat. Things like bananas, etc., which are incredibly high in potassium. When your kidneys aren't functioning, it actually stops the body from removing the potassium from their blood, which can cause severe heart conditions and even heart attack. But we are very lucky because we have an amazing dietary staff here who help us guide ourselves through our journey. They're incredible about providing reasonable resources as far as finding creative and nutritious, but not horrible tasting food. So here's Danielle, one of our dietitians, and she's come just to speak about what she does and how what she does affects everyday patients.
Hello, my name is Danielle. I'm one of the team of dietitians here at Grand River Hospital, and our job is to work with our patients on dialysis and even before with chronic kidney disease to help provide individualized advice and help them to navigate the kidney diet, which is known to be quite complex and challenging for patients to follow. One of our goals is to give them, like Brenden said, foods, ideas that taste good to work with their cultural and individual preferences, and we help them navigate how much protein they need, how much salt, and then those specific minerals like potassium and phosphorus as well.
Excellent. Thank you very much.
You're welcome.
We have a lot of resources here in our program that are there to support patients, not just with their health, but also with some of their individualized issues, etc. And people who work alongside our hospital administrators, nurses, doctors, to provide reasonable resources for people should they need them. For example, we have a patient and family advisory council, which talks about the direction of our program and helps deliver a patient's point of view as far as changes that will affect them in their regular dialysis treatments and in their lives. And so PFAC is a mixture of management people and patients who drive our program into some amazing things, including working with the Kidney Foundation and the Grand River Hospital Foundation to help increase the amount of people on their team that can help deal with each of the many, many issues that come with renal failure and subsequently dialysis. So we're incredibly lucky to have a team that does that. Melinda, do you have any, if you'd like to provide some perspective as far as the employee side? of
Sure.
PFAC?
Yeah, Brenden and I sit on PFAC together along with other representatives in the program, and it really is that opportunity to give the patients a voice so they can contribute to the program as a whole and be involved in the future of our program and what decisions are being made. They've been wonderful, and we are extremely thankful for partnerships that we've been able to forge through PFAC in terms of getting new chairs for our dialysis units, and they've really been instrumental in our overall goal for the future for our program. We encourage you, if you have any questions, to please use that feature and ask us questions, and we'll do our very best to answer them. One of the questions I think we most often get is really, how does that dialyzer work? So we actually have one that's cut here, and it might be a little bit tricky to see, but there's thousands of these tiny little fibers inside that dialyzer. And believe it or not, the blood cells are actually small enough to go through each of those fibers. Think of it a bit like a fabric straw. And then the dialysate fluid, or the solution, actually surrounds those fibers. And this is really where the magic happens in terms of that osmosis and diffusion. Think about it like making tea. When you put that tea bag in hot water, you need that water to permeate the membrane and to bring that tea out of the bag and into your hot water. So that's kind of what's happening in the dialyzer itself.
So question, Melinda, does the blood go inside the machine or is it staying outside?
That's a great question. The question was, does the blood ever disappear inside the machine? And it absolutely does not. Exactly where you can see it is where it is. It stays right within these tubings. It does not ever disappear inside the machine. And this is also what we spoke to previously about how it is a relatively small volume that is outside the body at any given time.
So Brenden, how often do you do dialysis?
Typically, most patients probably go on a 3-day-a-week program. I, because of my kidney function, and I find that more dialysis tends to work better for me specifically. So they've actually tailored a program which allows me to do shorter runs nearly every day. So I come here 6 days a week for about 3 hours, which is the length of the run. But you also have to worry about putting in your needles, etc. So it can be very time consuming. Many patients take dialysis 4 days a week and even more. So it is quite encumbering upon their daily lives. And it's not simply what happens during your dialysis session, but it also carries on. When your dialysis session is done, it's not as if things just automatically go back to normal. You will still have symptoms. It can be incredibly tiring. And it doesn't necessarily have the ability to remove all of the waste without taking some of the good that you need. So many patients are on multivitamin supplements, etc., to help regulate their blood levels. Again, potassium, phosphorus, which can cause extreme itching. And that's one of the most, I think, as far as senses go, it's one of the most significant and noticeable things when you have things like phosphorus and potassium that get high. Lower albumin levels can cause you to feel weak. Again, there's always cramping, which is a huge thing. And again, that's one of the things patients complain about most. So it's one of those processes that really does take over a huge portion of your life and lasts forever. Even though you may not be on dialysis, and should you have a kidney transplant or whatever the case is, it takes huge amounts of medication, and it is a disease you'll suffer with your entire life. So it can be overwhelming, especially as time passes. There's resources for people who are experiencing mental anguish, etc., or even just need somebody to talk about. The Kidney Foundation's peer-to-peer support program is absolutely amazing. It allows you to communicate with other patients. They have speakers to come in and talk about specific dialysis issues during each of our meetings. And now with the virtual program happening, we have better access. So we see the amount of patients that normally would not necessarily either have the time or ability to attend the in-person. There is amazing virtual sessions that allow you to connect with other renal patients. So it's an amazing group. I think it's important we should recognize the Trillium Gift of Life Foundation, which encourages people to seek donation. One of the things that I know it's tricky to speak about, but deceased donor transplants, not just for your kidneys, but just your body in general, is super important because this disease goes on forever. But it is truly life-changing to receive a transplant. And even if it doesn't necessarily last you the rest of your life, even if it, like for me, lasts 2 years, that's 2 years that I would never change. You feel as if you're getting part of your life back. So yeah, there's all kinds of medications, etc., and there are downsides, but having been through the extremes of dialysis, transplantation, and then returning to dialysis, those 2 years were, they just changed your life, even if it is just for a short period of time. So it's important to acknowledge those people, Kidney Foundation, the Kidney Patient and Family Alliance of Canada, which actually helps bring all of those resources in places together. The Kidney Foundation, which helps facilitate research, which will drive patient care. Renal dialysis has many nuances that have not been necessarily addressed in the most unreasonable way. So funding these projects, like right now, we're in the middle of a, I believe we call it DialMag, which is a way to see if the concentration of magnesium in your dialysate is better or inconsequential, etc. So those studies are incredibly important, and patients actually take part in it. I've been very lucky to be able to serve as a patient partner on a study including the DialMag trial. So I really appreciate the perspective of the patient partner and encourage all patients, if they have the ability and the time, it's important to find something that you can be passionate about if you can, and that over the long run can greatly impact other patients, as trials are vital to safety, etc. Without those, we will never advance and improve the quality of life for other patients. So I think it's amazing that we've had that opportunity to serve in that way.
So Brenden, based on sort of the research aspect, we've got a question. Are there any updates about mechanical kidneys that can be transplanted like heart valves?
So I think at this time we don't have any specific information as to that. But if I can just touch on what Brenden was saying in terms of the, support that's required, it really is one of the driving forces for us to make sure that we are providing that patient-centered care and that we are involving all members of the allied health team. So those pharmacists, the dietitians, the social workers, to really make sure that these patients don't feel like they're trying to navigate the journey on their own and that they have some allies on their side to really help make it as easy as we can. And really, we are driven to get that best quality of life that we possibly can for our patients. I have to say that myself, I've been in dialysis here as a nurse for 11 years, and it really affords me the opportunity to get to know these patients really well because it is a kind of a chronic disease process. So for myself as a nurse, it's incredibly rewarding to work alongside these individuals and to get to know them and to see them on their journey and to really see them, flourish as we make minor adjustments or we work together with the pharmacy and dietitian team to adjust some medications or some diet. We really get that opportunity to follow back and to see how those improvements impact the patient.
Do you have to come to the hospital to do dialysis?
So we have a question. Do we have to come to the hospital to do dialysis? That's a great question. There are different types of dialysis modalities. Some of them are hospital-based, either on an outpatient basis. But we do offer home-based therapies as well. So definitely for individuals that have, very active lifestyles, they work, they love to travel, we can look at things like a home hemodialysis where you can actually have a machine a little bit smaller than this at home to do your own dialysis. Or we have something called peritoneal dialysis, and Brenden briefly mentioned it earlier, and that's where we utilize the peritoneal membrane in your belly for dialysis. So again, it goes back to finding that right modality and that right access that really fit you where you are right now, and tailoring that treatment very specifically to the patient to meet all of their needs. We have about 2 minutes.
It is actually very remarkable to be able to get to know the people. I know it's cheesy, but because a lot of people use the word family. In a lot of ways, a lot of our dialysis patients our nurses are lifers. And so a lot of our nurses tend to stick with dialysis because you develop relationships, not just among the nurses within their own group. Patients actually get to know over many years frequently your nurses. And it's as if you have a champion in your corner at all times. People who even just will listen to what you're saying, and even if it has nothing to do with dialysis, they can help. Even just venting sometimes can make such a big difference, and it makes it very important for those allied health people to get to know their patients, and that can improve quality of life, not just for patients, but also for nurses, I hope. So we're incredibly lucky to have such a large dynamic team of technicians and nurses and doctors, social workers, pharmacists, etc. And they are the catalyst that helps drive your kidney care. And they're amazing people who, if you have a chance to know them, it really does make a difference in improving your overall quality of life. So thank you guys.
We really thank you for joining us, and we hope that this opened your eyes and brought some awareness to our little corner of the medical world in our kidney care. And we would encourage you to follow, as we will be providing some follow-up information later on social media. Thank you.
Thank you all very much, and I appreciate the opportunity to share in this presentation to help the nurses. If we can in any way encourage nursing, it's been a long 3 years, and nurses have been champions for every patient across every potential issue. So we owe them a great thanks. And so, on behalf of myself, I thank them and the amazing team, the management staff, the clerical staff that really do act as the most important cogs in a very large machine.
Thank you.